Yeah, so there's been a lot of some preclinical data and some observational data in other diseases that metformin actually has anti-neoplastic properties. But this has never really been looked at in patients with metastatic renal cell carcinoma, specifically in the impact of metformin in patients with RCC. And the purpose of this study was to use a large database of clinical trials to actually assess whether metformin use actually impacted outcomes for patients with RCC. So the cohort included over 7,000 patients. Of those, there was a small percentage of patients who were actually diabetics who were metformin users, but when we compared users of metformin to users of other anti-diabetic agents, not including metformin, we found that there was actually no difference in survival for the total cohort. Additionally, we did various subset analyses in patients receiving VEGF-targeted therapy, mTOR-targeted therapy, interferon therapy, and also found no difference with whether patients received metformin versus not. We stratified by risk group as well, by IMDC risk criteria for favorable disease, intermediate disease, and poorest disease, and didn't find a difference. But where we did see a difference was in patients who were specific users of sunitinib. In patients who used sunitinib and also utilized metformin who were diabetics, there was an improvement in overall survival for those users of metformin. And that, there's certainly a lot of, this is very hypothesis generating data. You can't really draw too many conclusions from it, but I think it speaks to the fact that there potentially may be some kind of synergism happening with the Sutent, which is a VEGF-targeted agent, and metformin, that they may be able to somehow synergize with each other. And I think further studies in the preclinical setting are warranted to kind of investigate why is this interaction even happening, and probably larger observational studies need to kind of validate these results.